चालू कर Very good morning, Dr. Bhupinder Singh, all chief guests of the today's inaugural function, all delegates, and my staff colleagues. I heartily welcome you for 1 week online international e-faculty development program and e-student training program on a subject of empowering pharmacy education, navigating regulations, global trends, and advancing outcome-based education and research under the aegis of Internal Quality Assurance Cell of Gokhale Education Societies, Sir Dr. M.S. Gosavi, College of Pharmaceutical Education and Research, Nasik, Maharashtra, India, in association with Association of Pharmaceutical Teachers of India, that is APTI. I'm very happy to mention you here. We have been organizing this kind of e-FDP and e-STP since there was an emergence of Corona 2020. In a very early first year in 2020, near about 1,600 delegates had attended this e-FDP and e-STP, and that had motivated us. And since we have been organizing this e-FDP and e-STP on different topics of pharmaceutical education and research. We could do all these things because of the great support of our educational institute, that is Gokhale Education Society. Very unique feature of our society, sir. It is working on a principle of above self and above politics, and another principle, Vidyarthi Devo Bhava, because this society was established by a teacher, Principal T.A. Kulkarni, in 1918. So the society is having a legacy of 107 years. We have 140 institutes spread over 3 zones of Maharashtra, Mumbai, Palghar, and Nasik, having junior colleges, schools, senior colleges, and professional educational institutes. All the senior colleges are accredited by NAC and re-accredited by again NAC once, twice, thrice. And most of our colleges are pioneering in Maharashtra. Mainly, we do consider North Maharashtra. That was the first college in the North Maharashtra, HPT Arts, which was established in 1923. Like this, we have some professional educational institutes. Very first engineering college started in 2009. Before that, in a very early 1968, the society has started first university program, that is MBA, Management in Business Administration, under the guidance of Dr. J.R.D. Tata and Shantanu of Kirloskar. So we are having other professional institute like polytechnic colleges. Then as a health education concern, we have a nursing college, physiotherapy college, and this pharmacy college. As I mentioned, society was established by teacher, run by teacher, lead by teacher. So currently, this society is led by a very dynamic leader, that is Professor and Principal Dr. Mrs. D.P. Deshpande Madam. She shouldered the responsibility of Secretary Gokhale Education Society, and the President of the Society, Dr. R.P. Deshpande Sir, with the support of Project Director Sri P.M. Deshpande Sir, and our mentor and Establishment Director of Gokhale Education Society, Sri Shaileshji Gosavi Sir. This college, sir, name after Sir Dr. M.S. Gosavi Sir, who had given 65 years of his life for a dedication to only education, education, and education. He became a principal at the age of 23 and remained principal for more than 37 years. That is a world record. Then he became a secretary of Gokhale Education Society in 1973, and he was a secretary up to 2023. So he had given 50 years of his life for a society as a secretary, and total 65 years is life for education. Very dynamic personality, and our college is named after him, Sir Dr. M.S. Gosavi, College of Pharmaceutical Education and Research, Nasik. The college was established in 2012, and a very short span of 10 years, our college have achieved many milestones. Among that, we started additional intake in 2017 from 60 intake in 2012 to 2007 300. B.Pharm in Tech. Then same year we started diploma program with the 60 in Tech. Then in 2018 we faced the NBA and we got accredited by National Board of Accreditation. And I very proudly mention here, ours was the first pharmacy college. We faced NBA accreditation at the age of 6 and got accredited. And then in 2020, we started M.Pharm in pharmaceutics. Then 2022, we started pharmaceutical quality assurance. And the same year, we also got research center, that is a PhD program affiliated to Savitribai Phule Pune University. Not only the college achieved, but college teaching staff and our students have achieved many, and they brought many laurels to a college. Some students represented college at national and international level, both in academia and non-academic activities, that is extracurricular activities, represented Savitribai Phule University in elocution competition, in basketball tournaments, and our staff member, near about 8 staff members visited 8 different countries, and they presented their research papers. Not only not only staff, but student also visited different countries to present their research papers, and attended different conferences and seminars. And not only with this, the college is also doing very well in all extracurricular activities. We have been organizing seminars every year, 2 seminars, one seminar mainly for a student-centric seminar. That is very unique activity. We started since inception of college, that is 2012. That is only for a students-related seminar, and we mainly focusing on GPAT, that is a competitive examination for M.Pharm admission, and we have been doing since last 12 years. That is not only getting benefited to our college students, but whole Nasik district college students. We are inviting all them. There is a free registration and full day, one seminar on student-centric seminar. And as I mentioned, we have been mainly focusing on competitive examination, GPAT, and students are getting benefited that. Then every year we do organize one conference, 2 days conference in a month of February, and e-FDP and e-STP in a month of March. This we have been doing since last 5 years, this e-FDP and e-STP. And in a very short span of time, the college has a very good name in a Nasik district and in Savitribai Phule Pune University. By considering our efforts, Savitribai Phule Pune University has given 6 time Best Magazine Award to our college, and our society also considered our efforts and given twice Best Institute among 140 Institute of Gokhale Education Society. So this is all about college. As I mentioned, we have been organizing this since last 5 years. This year, this e-FDP and e-STP on empowering pharmacy education, navigating regulation, global trends and advancing outcome-based education and research. So there are total 19 speakers who are going to talk on different topics of pharmaceutical and pharmaceutical science related. Consider very first, today we have a very important topic as an education concern. Dr. Bhupinder Singh is going to talk on mentor-mentee relationship. As consider the today's education scenario, it is a very, very important topic to have a good interaction with the students and faculty. So that definitely boosts the confidence among students, and they can do much better in a pharmaceutical education. And that's why then other topics including electrophysical, physiological methods for drug screening, both research and development of the student, then combat health challenges, nanopharmaceuticals, the coming topics in a pharmaceutical research, very, very important, because we can reduce our dose and we can target our drug at the site. And that's why nanopharmaceuticals in a near future could be a very important topic. Then transforming pharma healthcare, role of artificial intelligence, not only our health education, but we have to have a combination with the technology. By using this technology and this artificial intelligence, we could analyze the data, and it could be very helpful for pharmaceutical science students to go for a research and analysis of a data. Means mainly in our patient compliance could be increased by doing the analysis of data, and that's why artificial intelligence and machine learning, this could be the additional topics in pharmaceutical sciences. Then biocatalyst, emerging significance of social media, quality by design, outcome-based pharmaceutical education, COPO assessment as accreditation concern, understanding of bioavailability and pharmacokinetics, ethics and integrity in research. Now, this is very, very important topics. Only research is not important, but ethical research is a requirement, and definitely this will enlighten among the delegates what kind of ethics we have to follow and integrity in research. Accreditation assessment criteria, in silico approach in drug discovery and development. This is another very, very important topic. Every time we may not be able to do by animal study or other thing, but by doing this silico approaches in drug discovery and development, that has reduced the time for a development of the drug and formulation also. Global pharma perspective of pharmacy education and practices, how to select drug molecule for formulation and research, integrating organ on chip technology into education research, industry academia translational research, a case study on the Punjab University campus and beyond. So whatever topics we have selected for the e-FDP and e-STP definitely could be very, very helpful for all delegates, because in a coming years we have to have a knowledge of pharmaceutical science, but along with that we have to also have a knowledge of technological knowledge, and blend of this technology and healthcare knowledge could be very, very helpful and could create a lot of opportunities for a faculty member as well as student of pharmaceutical science. And I'm very sure all these 19 speakers could give more insight and share their expertise on a different topic, and that could be very, very helpful for delegates, and very sure definitely the delegates can learn many things from this e-FDP and STP. And I'm very happy to mention here that for this e-FDP and STP, 500 plus, means 503 delegates have registered for this e-FDP and e-STP, and from not only Maharashtra but throughout the India, and as an international e-FDP, not only in India but also outside the India like Malaysia, Thailand, Nepal, and other countries. Delegates also have registered for this e-FDP and e-STP. So I'm very happy with this response given by delegates for the e-FDP, and that motivates us to organize such kind of e-FDP years and years. So once again, I'm very much thankful to Dr. Bhupinder Singh for being a chief guest for this inaugural function. The sir is very well known globally for his scientific research work, especially on a systemic development of novel drug delivery using quality by design approach. This is a coming approach, very, very useful. Then nanomedicine, another very important topic, sir, is a master in that, advanced pharmacokinetics and computational pharmaceutics. So, sir has contributed more than 40 years of his life to a pharmaceutical education, research, and industry. And definitely, the expertise of sir will help for all delegates. So, I again welcome to Dr. Bhupinder Singh, and thank you very much to you, sir, for attending this inaugural function and going to deliver a topic on a mentor-mentee relationship. And again, I welcome to all delegates and thank you for your great support. Thank you. Thank you very much.
Thanks indeed. Am I audible?
Yeah, yes, sir.
Yes, sir. Yes, sir. You are.
Am I audible?
Yes, sir.
Yeah. So thanks indeed, Dr. Sunil Amritkar. And, I got to know about the college, that is Sir MS Gosavi, College of Pharmacy Education and Research. This is my second privileged occasion to be
Yes.
connected with you all and the faculty participants. I take this as an honored privilege to be amidst all of you as the honored chief guest of the faculty development program and the program for student training, and the theme that is empowering pharmacy education, navigating regulations, global trends, and advancing outcome based education, what popularly is abbreviated as OBE, and research, is indeed a contemporary and crucial topic that resonates deeply with the current transformation in pharmaceutical education and profession that's taking place, across the country, across the world in general and country in particular. Ladies and gentlemen, the faculty colleagues and the students, the landscape of pharmacy education has been growing significantly over the years, decades, and centuries. Gone are the days when it used to be taught as a simple subject of pharmacy in the University of Sciences at Philadelphia in the early 18th century. Now, today it has expanded into a multi-dimensional domain that integrates with the modern paradigms, patient care, regulatory sciences, and research-driven innovation. The paradigm shift from the traditional learning to OBE ensures that graduates possess the right competencies to meet industrial and healthcare demands. Also, the pharmaceutical sector today works within the highly regulated environment, be it at the pharmaceutical arena, that's in the pharmaceutical sector, pharmaceutical industry, we are regulated by bodies like US FDA, EMEA, WHO, and the Indian Drug Control Journal of India, and other regulatory, organizations at state level, maintain the standards of pharmaceutical products and processes, and to ensure, of course, the patient safety, efficacy, and the quality of the medicines which we are taking regularly. While PCI, UGC, AICT, and the other accreditation bodies like NAC and NBA, they set the standards of the education to ensure quality education. So pharmacy educators and the students must stay updated on evolving regulations, and particularly compliance with the GMP. I think the teachers and the students must be knowing about the recent guidelines of the government of India to comply with the Schedule M, that's the GMP, guidelines, and for which they have extended the deadline to by one more year. That's till 25 December, and the compliance with the regulatory perspectives would ensure the quality, efficacy, and the safety of the medicines. Similarly, compliance with the regulatory standards of the regulatory bodies within the country would ensure the quality of the education. So the pharmacy today is multidisciplinary, cross-disciplinary, and interdisciplinary. As Dr. Amrit Kaur was, mentioning today, it has to encompass the elements of artificial intelligence and machine learning, that's popularly called as AI/ML, particularly in drug discovery, personalized medicine, that's customized medicine, customized according to the needs of the patient. Nanomedicine, he also mentioned about nanopharmaceuticals, pharmacogenomics and gene therapy, 3D printing, and blockchain and data integrity in pharma sectors, artificial organs, and regenerative medicine through the concepts of the tissue engineering and stem cell therapy, popularly called as stemceuticals, vis-a-vis the pharmaceuticals, green chemistry, and messenger RNA technology, which is being very popularly used in the next gen vaccines, including the COVID vaccines, which were, used for, immunizing all of us during the recent COVID era. With digital health, they are coupled with digital health technologies, telepharmacy, pharmacovigilance, drug safety monitoring, biopharmaceuticals. In India, we are witnessing an era where there is a lot of upsurge on biosimilars, which are the generic versions of the biopharmaceuticals, to grossly shape the pharmaceutical profession. So, outcome based education, OBE, in particular, ensures that the graduates are job ready, because we are in pharmacy education, we are concerned about employment, while the the employers are concerned about employability. So employability will be better ensured through OBE, which needs to be research oriented and innovation oriented. So institutions like Sir MS Gosavi, College of Pharmaceutical Education and Research, and all others, need to reorient themselves to emphasize about industry academia partnership for creating research driven learning environments, experiential learning using various kinds of simulations, clinical case studies, and project based learning. That's very, very important. Project based learning, the through case studies, practical case studies. And entrepreneurship in pharmacy needs to be encouraged to make them employment generator rather than employment seekers wherever it's possible. Regarding the road ahead, the futuristic outcomes, we must empower the futuristic, the coming generations. For pharmacy education to remain relevant, continuously, meaningful, we need to work on curriculum innovation. We need to work on adequate investment in the research infrastructure. Faculty members play a pivotal role in shaping the students' careers, and students must proactively engage in lifelong learning. Not only learning within the precincts of the educational institute during their B Farm, M Farms, or for example D Farm and or Farm Ds as well. They should even go beyond for seeking to update their knowledge and know-how, by lifelong learning, techniques and global networking and research collaboration. India today is one of the largest producers of pharmaceuticals globally. It has been known the pharmacy of the world for the last over 22-25 years. Nevertheless, several manufacturers have been embroiled with the issues of compromising quality. So we cannot remain ignorant. Lest ignorance be a bliss for all of us. The quality and integrity have been compromised by some of us as manufacturers, culminating into several drug products which are not found to be of standard quality, NSQ. Recent news items have been abuzz with many of the products being found of NSQ. I must compliment the organizers in this regard, Dr. Amrit Kaur, Dr. Prashant, and all the team members, for having selected this topic, which will address, all the pertinent issues, and which can drive the faculty participants as well as the research scholars and the students, attending this FDP, e-FDP, and e-STP to be conversant with all these diverse aspects, making them more employable. With advancements in research and technology, adherence to ethical standards, the pharmaceutical sectors in India can be poised for continued transformation. So as we move forward, we need to commit to fostering a culture of excellence, evolution, elevation, and ethics. I repeat, excellence, evolution, elevation, and ethics. Evolution tends to encompass innovation, that's out of box thinking for meaningful outcomes. Elevation, you know, taking the standards of the quality production and the quality practice and quality deliberations of the pharmaceutical, profession per se, elevated in our own eyes and across the world, bringing better name to the pharmacy across the world. So together we can bring pharmacy education at par with that of the global standards, making a lasting impact on healthcare and society, and India emerging as a global leader in next gen pharmaceutical innovations as well. We are doing great as far as generics is concerned. everybody knows that we are the third biggest producer of generics, but this is an era where we need to work on pharmaceutical innovations, because in terms of price, we are at 11th. In terms of production, we are at number 3. So if we excel in the innovative products as well, so who knows, that we may be amongst the top 3 or 2 in pharmaceutical arena overall. So thank you all. Thank you, Dr. Amritkar, for providing this opportunity, and best of deliberations to all. And in the subsequent session, technical session, which they have entrusted upon me, so I'm going to highlight the ethical issues in the research. That has been the topic which I had been discussing with Dr. Prashant and Dr. Sunil Amritkar. So I'll be talking, and of course, that will help in reinforcing the mentor-mentee relationships too. Thank you so much for your patient listening, and best of deliberations and outcome-based deliberations. Thank you so much. Bye.
Thank you. Thank you so much, sir. Thank you so much, sir. A very good morning, our today's chief guest and all the dear delegates. On behalf of Sir Dr. M.S. Gosavi, College of Pharmaceutical Education and Research, Nasik, I, Ms. Dipali Bhandari, coordinator of 6 days e-FDP and e-STP, would like to extend my deepest gratitude to our esteemed chief guest, Dr. Bhupinder Singh Bhup, sir, for gracing this special occasion with his presence and for his inspiring address. Thank you so much, sir. Your presence has undoubtedly added a significant dimensions of this inauguration. Thank you once again, sir. Now we would like to hear you soon for today's first session. Some instructions and the instructions are there for the delegates. Everyday feedback link on YouTube and at the chat box will be provided daily at the last session and also on a WhatsApp group. A link contains quiz based on all the sessions of the day, and everyone should submit the answers of the same for the certification. Thank you, everyone. Thank you so much, sir. Session will start soon, sharp at 11 a.m. Thank you.
Thank you. Thank you. All the best.
Yes, sir. Link will be provided to you.
Another link will be provided for a lecture. Yeah. Yeah.